Welcome to CCN Midday News. I am your host, Captivating Krishna. Here are some of your top stories for today, April 21st. Healthcare workers took a stand against protesters opposing the coronavirus lockdown in Colorado. States like Georgia, Tennessee, South Carolina announced plans to reopen. Some businesses wind down the coronavirus stay-at-home orders. Florida's coronavirus cases soar past 27,000 as the statewide death toll jumps up to 823. We are living in a failed state. The coronavirus didn't break America. It revealed what was already broken. The White House has erected a blockade stopping states and hospitals from getting coronavirus PPE. And for a reason, coronavirus is hitting the Black communities so hard. Let's get to the news. Healthcare workers in Colorado clashed with protesters who demonstrated on Sunday to demand an end to the state's stay-at-home orders. Dramatic video of a Denver protest went viral when a nurse in full scrubs was captured standing in front of a woman protesting from her truck. As the nurse silently blocked the truck from moving in a counter-protest, the woman wearing an American flag t-shirt and holding a sign that read "Land of the Free" shouted, "Go to China if you want communism." The healthcare worker was one of few who tried to counteract the protests yesterday that hundreds attended in Colorado, where over 400 people have died from the coronavirus. Alex, a Denver nurse who spoke to NBC's affiliate in the city, did not provide her last name. It said that the demonstrators on Sunday felt like a slap in the face to medical workers and was backwards. "I don't want to be struck in my house either. I don't want many people of all are enjoying this. That's not the point," she said. The protesters lasted for about 4 hours. The governors of Georgia, Tennessee, South Carolina on Monday afternoon announced new plans to bring their states' economies closer to full force amid signs of the coronavirus outbreak slowing down. Georgia's Governor Brian Kemp said certain businesses, including gyms and hair salons, can reopen beginning this Friday. Meanwhile, Tennessee's Governor Bill Lee confirmed his state's stay-at-home order, previously extended to April 30th, will end that day. And South Carolina's Governor Henry McMaster said businesses previously deemed non-essential, department stores, flea markets, florists, bookstores, and music shops could reopen their doors. Trump says decisions coming shortly on reopening economy. These businesses will open according to specific guidelines or guidance that we will provide in accordance with the state and national experts in both medicine and business. Lee said in a statement, "Social distancing works, and as we open our economy, it will be more important than ever to keep the social distancing as lives and livelihoods depend on it." Kemp said on Monday that his state would expand the COVID-19 testing and that hospitals were in a position to resume effective elective surgeries after securing the necessary protective personal equipment. Florida's Department of Health on Monday evening confirmed 398 additional cases of the COVID-19 since the morning, bringing the state's total of known cases of coronavirus to 27,058 as the state announced 34 new deaths, spiking the overall death toll to 823, even new death tolls in South Florida as well. In the Miami-Dade, the state added 8 people who've died of the disease, raising the county's death toll to 223, the highest in the state. Broward and 2 more deaths have risen the county's death toll to 122, now on par with the numbers reported deaths in Palm Beach County. Of the total confirmed coronavirus 19 cases in the state, of 29 are all Florida state residents. It is likely that the statewide total of the confirmed cases is significantly undercounted because of the state's reports only the number of Floridians waiting to hear test results from the state lab and not private ones. The private labs are completing more than 90% of the state's tests. The results of thousands of pending tests from private labs have taken as long as 2 weeks to be added to the state's official count. The state's When the virus came here, it found a country with serious underlying conditions and it exploited it ruthlessly. Chronic illness, a corrupt political class, bureaucracy, a heartless economy, and a divided and distracted public had gone untreated for years. We had to learn to live uncomfortably with the symptoms. It took the scale and intimacy of a pandemic to expose their severities, to shock Americans with the recognition that we are in a high-risk category. The crisis demanded a response that was swift, rational, and collective. The United States reacted instead like Pakistan, like a country with shrubbery infrastructure and a dysfunctional government. Those leaders were too corrupt or stupid to head off mass suffering. The administration squandered 2 irreversible months to prepare. From the president came willfully blindness, scapegoating, showboating, and lies. From his mouthpieces, conspiracy theories, and miracle cures. A few senators and corporate executives acted quickly, not to prevent the coming disaster, but to profit from it. When a government's doctors tried to warn the public of the danger, the White House took the mic and politicized the message. Whenever you start to think that the federal government under President Donald Trump has hit a moral bottom, it finds a new way to shock and horrify. Over the last few weeks, it has started to appear as though, in addition to abandoning states to their own devices in a time of national emergency, the federal government has effectively erected a blockade, like that of which the Union used to choke off the chain of supplies to the Confederacy during the Civil War, to prevent the delivery of crucial and critical medical equipment to the states desperately in need. At the very least, federal authorities have made governors and hospitals executives all around the country operate in fear that the shipment of necessary supplies will be seized along the way. In a time of pandemic, having federal responsibilities, the White House is functionally waging a war against stateship and the local hospitals to secure what they need to provide significant treatment. A Washington Post analyst from early data from jurisdictions across the country found that the coronavirus appeared to be affecting and killing Black Americans at a disproportionately higher rate compared to white Americans. Majority Black counties have 3 times the rate of infection and nearly 6 times the rate of death as the majority of white counties, according to the analyst. Why is it 3 or 4 times more so for the Black communities as opposed to others? President Donald Trump asked Tuesday the White House task force briefing. It doesn't make sense and I don't like it. And we are going to have statistics over the next probably 2 to 3 days. But based on what we know about the inequalities in many Black communities, it does make sense. The fix dug in to better understand why the coronavirus is apparently killing Black Americans at a faster rate than other groups. Here are some of the main causes. Higher rate of underlying health conditions and less access to care. Black Americans hold a lot of essential jobs. Insignificant information and housing disparities, among a few things. Once again, thank you for watching CCN Midday News. Hope you enjoy. Please like, share, and subscribe. Also hit that notification button so you will never miss another news update. Have a great day. Peace.